Welcome to our presentation of MoCA, or Multidimensional Optimal Care Analytics, produced by Walnut Creek Consulting. Our patent-pending invention supports behavioral health providers to optimize care using an automated machine learning process that saves them time and money, all of which can be redirected to improved patient care. What if providers could track the dynamic forces involved in treating severe mental illness? Providers had automated scheduling for optimal psychiatric care plans. Providers could forecast times of unplanned psychiatric admissions to emergency rooms and inpatient units. MoCA is ready to plug into your electronic health record and reduce inpatient admissions, save money on unnecessary interventions that can be redirected toward high-quality care for self-sufficiency. MoCA can track and forecast trends in care by major diagnosis categories for each individual patient. Care systems can now forecast the need for provider capacity based on number and kinds of patient encounters, expected movements between stepped levels of care for each individual patient, the best timing for interventions to move consumers to their highest level of self-sufficiency, and the level of integration of primary care in the overall mental health treatment for a particular patient population. The program captures the multiple dynamically changing forces involved in treatment and tracks them in a three-dimensional vector field. Each optimal stepped care level represents a vector that captures the power behind the optimal care and its aim. The system analyzes the current care vector, compares it to the nearest optimal care vector, and adjusts the current care plan to optimal care. The calculations behind this analysis capture all procedures on all 6 levels of care, frequency and intensity of care, care interventions by provider, client outcome measures, and social determinants of health. The system tracks utilization, allowing providers to identify system weaknesses and assess patient engagement levels. If the system detects positive overutilization, which can lead to better care, the provider receives a notification to decide whether or not to adjust the care plan. Better care utilization and prevented unplanned emergency care and inpatient admissions lead to cost savings. Our pilot study resulted in 12.1% cost savings across the board. Savings can be redirected to improved care. Providers can identify areas of concern on their real-time dashboard for each patient. Care system executives can direct dollars to programs based on length of stay, allowing them to plan and hire for the proper staffing levels. Please contact us either by phone at 707-580-5670 or email walnutcreek@currently.com for a short introductory conversation. You can also get on our meeting schedule directly at calenley.com/walnutcreek-bfo. We are looking forward to talking to you.